think we're going to go ahead and call the meeting to order. Marlene, if you could please start with our announcements.
Of course. Again, welcome everyone to Manhattan Community Board 11's Human Services Committee meeting. Until further notice, all meetings of Manhattan Community Board 11 will be conducted by video conference. Links to register to attend the video conferences for each of our respective committee meetings will be published on the meeting's calendar on our website. For those of you calling in, the website is www.cb11.org. To avoid crosstalk and help the meeting run effectively, panelists and attendees are asked to keep their microphones on mute when they are not speaking. It is also helpful to utilize headphones. Those participating by phone can dial *6 to unmute, and that is how you mute your line. If you wish to share a question or comment, you may do so by utilizing the raise hands function. Our staff, myself, will monitor to ensure that hands are recognized in turn. Those participating by phone can dial *9 to raise their hand. Committee members will be called on first, then attendees. Please keep your questions or comments brief. And I'm going to turn it back over to you now.
Great. I believe that our chair was going to present. Do we want to call order first, or do we want to have the chair deliver her remarks first?
You can call order, then call for an adoption of the agenda, motion to adopt the agenda, and then you can have Nilsa speak.
Perfect. So it is 6:05 and I'm calling the meeting to order. I would like to do a combination of kind of taking attendance and adopting and calling the meeting to order. So can I turn it back over to you, Marlene, to make sure that everyone is here and recorded accordingly?
No problem. Eva Chan.
Yes, present.
Thank you. Patricia Martin.
Present.
Thank you. Jennifer Meyer.
Present.
Thank you. Xavier Santiago.
Present. Aye.
Robin Straker.
I'm here.
And Nye Whitaker.
Present.
Thank you.
Great.
Rakeem Brooks is here too.
Thank you, Rakeem.
Awesome. Welcome. I'd like to have an emotion to adopt the agenda.
I motion to adopt.
Thank you, Pat. Seconded. Anyone?
Robin Strayson seconds.
Thank you. So the motion to the adopted agenda by Pat Martin, seconded by Robin. So I'd like to start the meeting by welcoming.
I'm sorry, Nye. Would you like me to call the roll?
Go for it.
Rakeem Brooks.
Yes.
Eva Chan.
Yes.
Patricia Martin.
Yes.
Jennifer Meyer.
Yes.
Xavier Santiago.
Yes.
Thank you. Robin Straker.
Yes.
And Nye Whitaker.
Yes.
The motion carries. Thank you.
Great. I'd like to welcome the chair of CB11, Nilsa Arama, who would like to deliver some remarks to our committee and to all of the members of the public who are here with us this evening. Nilsa, the floor is yours.
Good evening. Thank you, Chair Whitaker. I wanted to say hello to everyone, and I wanted to thank you all for attending the Human Services meeting. And I just wanted to say a brief statement before you start working on your agenda. I have discussed with what the committee spoke about last month with your committee chair, Nye Whitaker. And it's in regards to the moratorium and other discussions. And I just want to I want to thank you for the work that's been done. But this is such a sensitive topic that I would like this discussion to be done prudently and in full consultation with the service providers. I know that service providers were approached, but with the service providers that would be so impacted, both for treatment centers and for homeless facilities. I read what was put together, but I have issues with bundling all of this in a resolution. I think we have to be mindful of the need for services in the community and how they are being provided and how they need to be provided in an effective way to help the clients of those centers. While I understand the concerns of many in the community about the sheer number of treatment centers and support service centers in our community, we have to be mindful that there is a need for those services, while at the same time expecting quality provision of services for those providers. So I have tasked the chair of this committee with speaking on a monthly basis with service providers, which she has already started to do. I know there's a lot of work that has been done in our community, and doing a full assessment with the committee and reporting back to me on those discussions that are being had on committee. I think that once you speak to the service providers and get a real sense from them as to the services they're providing and what's going on, I think it will help to fully inform the discussions, and then the committee could move forward on crafting something, because anything that's crafted here has to go before the full board. So I just wanted to take a moment to thank you all for your work and to discuss the fact that I had this conversation with the chair. And we are not discussing the moratorium tonight. We have an agenda. Our committees have open meetings where everything is discussed, and we're discussed at the full board meetings. So all the information that is needed and questions asked should be targeted in these meetings only. Other discussions, that if there are questions about that, please make sure that you forward them to the community board, and we will answer as appropriate. And with that, I want to just send it back to Nye Whitaker, your very competent chair. And I thank you all for listening to me at this moment, because I know you have a lot of work to do. So thank you.
Thank you so much, Chair Orama, and also just thank you for your continued guidance and support of our work. We are committed to making sure that we are thoughtful and intentional and respectful of our community and the needs of our members as we move forward, and also to make sure that we elevate, highlight, and support the service providers in our community that are longstanding cornerstone and have been good neighbors over the years. So I thank you for being here with us this evening, and I look forward to working with you and the full board and our committee in future months as we continue to work on how to revamp the moratorium request, the resolution for a moratorium on new services. Thank you.
Thank you, Nye.
So I would like to go ahead and get back to our agenda with announcements. Are there any scheduled announcements that we know of, Marlene, before I open it up to committee members and the public?
No, there are no scheduled announcements.
So I'm going to start with the committee members. Are there any announcements from the committee members? If you could please use the raise your hand function. I also want to remind everyone that we need to be respectful of the chat. We are conducting business, and so the chat should only be used if you are sharing information, contact information about an upcoming event. Otherwise, we are asking everyone to use the raise the hand feature and to wait until you are called upon to share your comment or question. So is there a member of the committee that has an announcement about any other upcoming events or activities? Okay. Marlene, I don't see any. Do you?
No, I don't see any.
Right. I'm going to then ask the members of our community who are here with us this evening. Thank you for lending your time to our important dialogue of how we can support the health and human services and quality of life of our community. If you are a member of the public who would like to make an announcement, whether it's to announce your organization or about an upcoming event, I ask you to please use the raise hand feature at this time and wait to be called upon. You can also use *9 if you are on the phone. I do not see any. Marlene, are you seeing anything?
No, I don't see any.
Right. I would like to then advance the agenda. Great. So we have several informational updates because we do have 2 important agenda items slated for later. I would like to make sure we stay on time and on schedule. First and foremost, I have committed with our members of this Health and Human Services Committee to always have a standing open invitation to our local representatives from the New York City Department of Health and Mental Hygiene and our local representatives from the New York City Health and Hospitals Test and Trace team. So I'm welcoming Padmore John from our Center for Health Equity and the Harlem Neighborhood Health Action Center, and Lorraine Valentine, who's the Manhattan Borough Director for Test and Trace. Lorraine, Padmore, which of you would like to start?
I'll defer and let Lorraine go, and then I can come on.
Thank you. Lorraine, the floor is yours.
Thank you, Padmore. I appreciate that. I'm about to share my screen with everyone. Good evening, everyone. Happy Monday. Thank you for allowing us to be here today. I have a short presentation. All right. So here are our COVID updates from over the last year. These are the cases and percent positivity rates that we're really concerned about. As you can see here on the chart, these are the cases since last March citywide, and they've increased now over the last winter months. On the bottom, we have something new, which is the probable antigen test that show folks if they have COVID now versus the antibody test, which shows you if you've had COVID-19 over the last 90 days, forgive me. The current situation in New York City, our percent positivity rate is 8.20. This is as of February 1st. DOH has not updated the site yet. We don't expect any updates till probably tomorrow or Wednesday at the very latest. So on here, you can see we're decreasing total cases, decreasing in hospitalizations, but we've been stable with the confirmed deaths, unfortunately, in the city over the last 4 weeks and over the last week. And so our outreach efforts in Manhattan, just to give you a snapshot real quick of what we've done towards the end of January, how many masks were distributed, almost 60,000. These are our mobile testing truck sites. And our outreach schedule for the last week and a half, and we're anticipating another storm tomorrow. Manhattan was slated to be Get Tested Tuesday, and we had a West Harlem site, and Harlem, we had Annunciation Church, but unfortunately they've canceled the mutual aid because we're expecting really bad weather. So we'll be rescheduling that for later this week, and we'll be sharing our calendar later this week as well.
Yeah, call my phone because they still got work to do.
I'm sorry, someone's not on mute. And so let's talk about vaccination real quick, which Padmore will get into further. Here's how we'll make an appointment, and I sent this slide deck to Marlene so she can share this with everyone. We do know that there have been some serious issues with the vaccine line and also the website, especially for those who are technologically challenged or do not have Wi-Fi, or do not even have computers or access to an iPad. So we're aware of that, which is why the city has been doing these pop-up appointment sites like you saw last week at Yankee Stadium, where they'll do them in the community and for the community. And so also to ensure that the community members, no one's, I would say, dipping into the amount of vaccines that we have. We're now checking folks' license, their state ID, to ensure that the amount of vaccines that are allocated for the community stay within the community and that they're being used by community members who live in that area. So in the interim, we want folks to make sure that they're still practicing the 4 core, which means that we're really focused still on non-pharmaceutical prevention for COVID-19. You still have to wear a mask, you still have to wash your hands, separate, stay 6 feet apart, and if you feel sick, stay home, get tested if possible monthly. I want to make sure, I know this looks like a lot, and these are the important websites that folks should look up for themselves, especially when we're talking about data on COVID, if you're really interested on that. some guidelines here. There are a few holidays still coming up, which is why we still leave that. You know, we have Lunar New Year starting on the 12th, but we've already gotten started with putting up some of our Lunar New Year events, where we anticipate folks will still be doing small gatherings. And we have Valentine's Day coming up on Saturday, so we need to make sure that our community is still staying safe and not spreading the virus. In the interim, I also want to say, I didn't get to put here, but Marlene has actually a couple of other documents which we've circulated within the community. We now have a digital version of a vaccine FAQ that can be shared with your community in both English and Spanish as well. So, and any other, a couple of our mailers that were sent out to our seniors, and some post-vaccination information that folks should have and be aware of, such as we still need folks to wear their mask and to ensure that folks get that second dose after they've already had the first dose. And I'll let Padmore get into it more.
Before we switch, are you okay, Lorraine, just to share your personal experience?
Yes, absolutely. Thank you, Nai. So I did get the first Moderna vaccine at a health and hospitals facility. I'm an essential worker. I'm in high positivity rates almost on a daily with doing outreach for us for New York City Health and Hospitals. And so I did mine at Lincoln Hospital. I was sore in the arm. I did get some of the side effects. I had a small fever. I had a headache, and I was a bit nauseous, but after that, I you know, flu-like symptoms, just like they said. But after that, I was okay, up and running, and so did a few of my other colleagues as well. They experienced the same. But you know, oddly enough, my grandmother, she just got her first shot on Sunday, and she was fine. So she didn't have any of the symptoms I did. So I guess that it is really unique to the individual.
Thank you, Lorraine. Padmore, would you like to continue?
Yes, hi, good afternoon. Can you hear me?
Mm-hmm.
Good afternoon, everyone. Not sure my video is not showing, but I guess it'll come in soon.
We see your video and we hear you.
Oh, okay, great. I just wanted to make sure, and thank you very much, Maureen, appreciate it. There are just a couple of things I always want to start off with where we are. Now, can I share my screen real quickly?
Marlene, does he have access to do so?
Yes, he can share his screen.
Thank you.
Okay. So, and I will put this in the chat as well. This is the vaccine tracker. It shows us where we are at the moment in terms of the percentage of individuals from New York City and outside of New York City that has been fully vaccinated. As you can see, fully 100% are fully vaccinated, 73% from New York City of all the doses that have been administered, 27% are non in New York City. And right now, the city is also making a much more effort to ensure that individuals who are receiving vaccines are from the city, that are receiving the vaccines within the city confines. In terms of the breakdown, a little bit more breakdown of those numbers, we're seeing that out of all adults who have at least received one dose, there are 47% are white, 16% are Asian, 15% are Latino, and 12% are Black. We do have another percentage that's 10% that has identified as other. So this kind of just gives us an idea of where some of the distribution of the vaccines are, and also to identify the different ways and different communities that we need to target to ensure that everyone has an equal opportunity and equal access to the vaccine. So of course, you know, some of the communities that, for East Harlem, for example, we want to make sure that there's an increased number of individuals from the community that having access to the vaccine. And I will speak to that a little bit later. The other thing that we also want to be able to show is testing. As you heard from Laureen, testing is one of the key components of making sure we identifying where certain parts of the community that needs increased resources, PPEs, For example, right now in East Harlem, we're seeing that 8.5% over a 7-day period from January 30th to February 5th. We're seeing that we have a 70% positivity of 8.5%, which is pretty high, showing that there were 200 new individuals that were tested positive recently. Right, so that's something we definitely don't want to have increase. In terms of for 10035, 6.39%, and 69 new individuals that have tested positive. So all that to say that we have to continue being able to ensure that we are, going by the call for, as Lorraine said, continue to wear masks, isolate yourself, stay home if you're not feeling well, and of course, wash your hands with soap, hand sanitizer. And a key component of that as well is just making sure that we are testing on a regular basis. So there are a couple of locations, and I will just want to show where we are right now in terms of eligibility. As many of you have heard, just recently, as of February 2nd, individuals were, there were some new individuals that were added to eligibility group. That is taxi and limousine commission licensed drivers and restaurant workers. All the eligibility for the previous individuals remain the same for those who are 65 and older, healthcare workers, and the like. We are encouraging everyone to be able to, if you are able to get an appointment, that you take the appropriate documentation to identify yourself so that you have no issues in terms of receiving your vaccination. Specifically for the restaurant workers, to let these individuals know that a pay stub, a letter of documentation from your employer, or some sort of ID demonstrating that you are working for a particular establishment is acceptable. And so we want to make sure that that is being done. Specifically to East Harlem, there are a couple of sites that are conducting vaccinations right now, and we want to make sure that everyone has access to these sites. Of course, there's a Metropolitan Hospital, and you have to go on the vaccinefinder.com .org to be able to have access to that site. There's also vaccinations that are occurring at the East Harlem Action Center, which is located on 115th Street and Lexington Avenue. Now, to be able to get that center, one of the things that we have been doing is looking how we might be able to accommodate individuals from the community. So what we are working on right now, the only vaccines that are being given at this site are for second dose. So if you already received the first dose, you'll be able to get a location at that for the second dose at that site. But starting,
I just want to keep you on time. So I'm going to give you about 1 more minute if that's okay.
That's perfect. So just wanted to finish up by saying that starting in March, that location, that site will be able to start doing first doses, and we'll be able to try and provide special allotments and slots for community workers. So when that process has been finalized and developed, we'll be coming back here to be able to let everyone know how that process is going to work. Thank you.
Great, thank you so much. Thank you to Padmore. Thank you to Lorraine. I'm going to open it up briefly. I want to make sure we stay on time to any questions from the committee first. If you could please raise your hand. Once the committee has gone through their questions or comments, then we will extend an opportunity to the public. So is there any members of the committee with a question? I want to make sure that it is a question and not a comment, just because I want to make sure we stay on time. If it's a simple comment, you are welcome to add it to the chat. I welcome links to be dropped in from our speakers so that we can all stay informed. Marlene, do you see a hand raised from any members of the community? I believe I see Angel with the hand raised.
Yes, Angel's hands is raised. Mm-hmm.
Great, Angel, the floor is yours.
Oh, thanks, Mike. Sorry, I skipped in front of Xavier, but you'll forgive me.
Oh, I saw yours first, sorry.
No, you're doing fine. I just wanted to bother Nick Xavier. I might have missed it, but I just wanted to ask if the presenters could remind us the hours and the days that the vaccines are being given.
Yeah, so at the Action Center, which is 115 and 115th Street, Lexington Avenue, currently, which is only the second dose at the moment, but it's typically given 6 days a week, Monday to Friday, Monday to Saturday, from, I think we start around 9 a.m. and going on till, well, the last doses are given around 5:30, but we are accommodating time for individuals to be able to have 15 minutes of observation. So we typically finish around 6 o'clock. There are some times when extra doses that are made available, and we're reaching out to individuals who may be on a waiting list, and they would typically come between around 5:30 and 6. So we just keep it open a little bit longer for that, but it's typically 5 days a week. I mean, I'm 6 days a week, I'm sorry.
Thank you, Pat.
Thank you. Angel, Xavier?
Thank you, Padmore and Lorraine. What plans are there to help our homebound seniors at the moment? We've had a lot who are unable to actually leave their homes, whether it's a NYCHA or more traditional apartment setting. They don't feel comfortable, or they have a physical inability to leave. What can we?
So right now, I know there are no specific finalized plans at the moment, Xavier. I know there are plans in place to be able to conduct a certain amount of vaccination at home, whether it's through a provider, whether it's through an organization that already has connections to those particular individuals. So those are being reviewed at the moment. The difficulty in being able to do that is just a challenge of the type of the vaccine and traveling with it from place to place. So that's one of the challenges. But I do know that there are plans in works at the moment to be able to accommodate very specifically to that population. And I'll drop this in the chat as well. There's also some resources that are being made available for individuals. I know they're not necessarily homebound, but individuals who have difficulty with transportation. So if you are trying to get from your home to a vaccination site, there's 3 different ways that can be done. Of course, through Access-a-Ride if someone has Medicaid, Medicare. There is a number for CURB, and I'll put this in the site. There's a CURB car service. I do not have it on me right now, but I'll definitely put it in the chat, as well as Hunter Ambulance service. Now, both of these services are being made available to anyone who who does demonstrate that they're going to a city, any vaccination site within the city, and they will not have to pay incur any costs to be able to get that service. I'll put this in the chat right away.
Okay, great. So we could push that out. I think a larger concern are those who have either experienced COVID and also have a mobility issue and are afraid of contracting it again, as has been reported in a few instances. So thank you very much, and thank you for all the work everyone's doing.
Thank you. Xavier, I wanted to add on to that and say that it's not a perfect system. We still don't have, as Padmore says, I mean, he would know better than I because he works from DOH, but we still don't have the ability to mobily go home to home, right, for the homebound folks. But the city has, we're doing these pilots in the NYCHA facility. So for instance, I'm not sure if folks have heard, a lot of folks have heard of what happened in the Polo Grounds last month with the vaccine. So the second dose of vaccines is going to happen this weekend for Polo Grounds for the folks who received the first, and that was a pilot that we're doing in the city to see if we can at least make it that accessible. And so that's been happening around the 5 boroughs as a means to overcome some of these challenges. Again, it's not perfect and it still doesn't address the folks who aren't really able to move from their apartment outside, but it's, we're getting closer. So that's where we're at right now.
Okay, thank you very much. It's a village effort for sure, but keep us apprised and we'll get the information pushed out.
Thank you. And just a reminder that Lorraine's team across Manhattan and also the 5 boroughs, who those may need it, have access to free PPE for our restaurants with Restaurant Week coming up, for our seniors, for our community members, for any in-person events, and also just deliveries, door to door in buildings, particularly to those who may be homebound or physically challenged. So please be in touch with her office for that. And I ask also to both Lorraine and Padmore to please also keep us abreast of any news about potential a potential opening of the La Maqueta site. I know it was announced by the mayor, but East Harlem needs some love. So please keep us posted as you get updates related to that. Are there any questions or from the public, Marlene? Any hands raised that I'm not seeing?
No,
There are no hands raised.
No, I also just want to point out that I put the information in the chat. So for this to our curb, which is the car service, 646-349-0289, curb 646-349-0289, and Hunter Ambulance Service 718-991-2211. No one should be charged for this. It's a contract with the city. So if anyone is getting any feedback that they're having challenges or being forced to pay, please let me know. I will definitely elevate that challenge and that issue.
Thank you both. Marlene. Thank you, Lorraine. Thank you, Padmore. We are going to transition to our next speaker. Marlene, I think just to stay on health, we're going to have Borican Neighborhood Health Center. Just so that you know, Anne Marie, I'm going to actually keep you to 5 minutes and then open it up for any questions. So that will be the total of the 7. We just want to keep it tight because we're at 6:35 and we still have some important items on the agenda. Also going to ask you, Anne Marie, to please drop your contact information into the chat so that we'll have a record of it. So Anne Marie, the floor is yours.
Hi, everyone. I'm Anne Marie Vasquez from Borinquen Neighborhood Health Center. I am the marketing outreach coordinator here, and I do have a PowerPoint presentation, and I would like to share it. Okay, here we go. Can you guys see?
Yes, we can.
Awesome. Okay. So Borinquen Neighborhood Health Center is one of the programs that's part of the East Harlem Council for Human Services, Inc. That's the mother agency, our organization, and we're one of their programs. So I'm just going to give you a little bit of history. The East Harlem Council for Human Services was established in 1965 here in East Harlem by residents and by people who were, by residents and the community. And so the board and staff got together and decided that, we needed a high quality, fully bilingual health and human service center here in East Harlem. The East Harlem Council for Human Services operates the following fully bilingual programs. Hello? Servicing more than 12,000 individuals each year regarding, without regard for an individual's ability to pay for services. So we have Borinquen Neighborhood Health Center, we have Borinquen School Health Program, WIC program, Bilingual Health Program, and Senior Nutrition Program. Those are all the programs that are part of the East Harlem Council for Human Services. And as you can see here, we're Borinquen Neighborhood Health Center. We provide all the medical and dental and behavioral health services here in the community. Then we have the school health program, which is clinics inside the schools. We have PS7, PS112, PS155. We have a clinic at those 3 schools. We have a physician assistant and a medical assistant there. And if the schools are closed, where the clinic is the backup. Women, Infant, and Children program, which is the WIC program. We have a WIC program. It's located here at Borinquen. Bilingual Head Start program. We have a bilingual Head Start program in East Harlem. It's we have one location on 116th Street and on 111th Street. And right now we are in a little battle with losing some funding, but we're trying to get support from community leaders and members in the community to see if we can get refunded. Senior Nutrition Program is our senior nutrition program in 2 housing. One is in Casabe Senior Housing, and the other one is in Schaumburg, and we provide meals and activities for seniors there. So those are the 4 programs. Wait, 1, 2, 3, 4, 5 programs at East Harlem Community Services. Borinquen Neighborhood I'm sorry, I'm trying to rush. Borinquen Neighborhood Health Center. So these are the services we provide. We have pediatrics and adolescent health, where we have great pediatricians. They speak Spanish, even Arabic. So we have 2 great pediatricians for that department. Adult medicine, geriatrics, where we have providers and also family nurse practitioners who provide all kind of adult medicine care. We have a pharmacy, gynecology, dental, nutrition, cardiology. So we have a cardiologist, we have 2 podiatrists, and we have 1 dermatologist, and we have an on-site laboratory, as well as care management, psychiatry, social work, chronic disease management for HIV, Hep C, where the patient would have a counselor, the doctor, the infectious disease doctor, and a coordinator. Then we have the PrEP program, which is part of the HIV program, and telehealth services, which is one of the services we started when the pandemic started. So it's the telehealth, but we have telemedicine and televisit for patients. We have the COVID-19 testing site where we test every day, Monday through Friday, 10 to 12, then it's lunch 12 to 1, and then 1 to 4. And that's fully running every day. And now we're at the vaccine. So we are providing COVID-19 vaccine to our staff, to CBOs, and also to patients over 65 at the moment. We also started a food pantry where we're providing food to our patients. Because of the pandemic, there was a big need, so we decided to start this food pantry program. We have about 100 families, and we work with First Spanish United Methodist Church and Friendly Hands Ministry, and they help us provide these patients the food. And we also have mental health videos where we provide these videos on diabetes and stress and anxiety to our patients. Sorry, I'm going fast, but we also during the pandemic had hosted a few flu shot COVID-19 testing in the community. We worked with the Boys Club, Union Settlement, HUD, 2 of the HUD residents, which was MS Houses, Taino Towers, and Robert Rodriguez office. They also hosted an event, and the First Spanish United Methodist Church. So we had about 11 events, and we actually were able to provide 107 people with flu shots, and 346 people got tested during these events. And as you can see some pictures there where we hosted these events, where they got the flu shot and the COVID testing. Then again, we have a site, a COVID-19 testing site right here on the side of Borinquen. So it's separate from, it's in the clinic, but it's a separate section. And we also hosted a census day during our COVID testing, and we are providing the vaccine, as you can see. And that's our information.
Great. Have you
went fast?
this, Anne Marie, did you email this presentation to Mark?
I did it today, but I did.
Great. Thank you so much. I'm going to ask the members of the committee if they have any questions, if they could please raise their hand to be acknowledged. And seeing none, I'm going to ask if there are any questions from, oh, wait, I just saw a hand go up. Marlene, can you tell me whose hand that is that just went up?
Sure, it's Joseph Di Benedetto. I'm
Okay.
sorry if I mispronounced your name.
That's okay. So first, anything from the committee? Okay. Then I'm going to turn it over to the members of the community. So Joseph, it seems you have a question.
Joseph, you're unmuted on this end, so okay, great.
Okay, can you guys hear me?
Yes.
Yes.
Hi, so I guess there was some technical and
Joseph, I'm sorry. It seems like you don't have a clear connection. We kind of lost you. I don't know if you want to repeat your question, or I will allow you to type your question into the chat, and I or Marlene can raise it for you so that it goes on the record.
Okay, I'll write it in the chat.
Thank you, sir. I appreciate it.
I just want to say that today I was told that we were trying to work with Taino Towers to be able to host an event, a vaccine event there at Taino's gym. So we're trying to see how we're gonna set this up, where we're gonna provide the vaccines to Taino Tower residents, whether they patients or not of ours. We're gonna start that way and then open it up to, I guess, the whole public.
Great. Please keep us posted about that, Anne Marie, and also please follow up with us about this concern about your funding for the Head Start. If there's a way that CB11 can be of service, whether that's with, some sort of letter of support or, we do have some small funding opportunities. So please feel free to reach out to us and let us know how we can support the crucial work of Borican.
Yes, it's the only, I'm sorry to cut you off. It's the only bilingual program here in in the city, actually. So it's very crucial that we keep that program. And I'll let you know about Taino Towers. I'll put in my information as well. Thank you.
Great. So 2 quick questions that I see here. One is from State Committee Woman Tamika Mapp, who's asked, do you have to be a patient at Borican in order to receive the vaccine services? Can you just be a member of the community?
A good question. At the moment, yes, you have to be a patient of Borinquen because of the limited number of vaccines we have. But like I said, we are trying to work with Tainos and see if we can start opening it up to people who are not patients from Taino first, and then maybe open up to the public. But we need help with that. We need vaccines and we need vaccinators, just like we did with the flu and COVID-19 testing events. So we're
Great.
working on that. But right now it's just patients.
Great. And Art is adding that you seem to already have a letter of support from CB11 for the Head
Yes,
Start.
Art Perez, he's our CEO.
Yeah, I remember when he came to us when he first joined. Also from Joseph, the quick question that he had was, he says, sorry, my internet connection is not too great. Is the facility doing walk-in COVID-19 vaccinations? I guess that's to clarify whether you can walk in or if you need a pre-appointment. So can you please clarify?
You need to make an appointment. You need a pre-appointment to get the vaccine. And again, it's for patients right now.
Okay, great. Thank you so much. I am not seeing, wait, hold on a second. Let me switch back. I see David Giordano has his hand raised.
9 from the committee.
Oh.
You have Eva Chan, her hand is raised from the committee.
Thank you so much. I was still in the attendee section, which is where Joseph was. So let me flip back over to the panelist section. Eva, do you have a question?
Yeah, so I have a more question unrelated to COVID. So I appreciate you providing such comprehensive health care for the neighborhood. And I want to get a sense from experience, what type of healthcare is in the most shortage in East Harlem, in your view? So for example, it's dental service, diabetes, HIV, psychiatrist.
I'm sorry, that question was for me?
Yes.
I'm so sorry. Can you repeat that?
Sure. So I said, thank you for providing such comprehensive
you're welcome.
care for the neighborhood.
Mhm.
And given that you see so much demand from different services, I was just curious, which type of services do you feel that is in most short supply that the committee can kind of ask for funding for to further support?
Oh, wow. The vaccine right now, we definitely need more supply. That's where
Yeah, I understood. I'm asking more a long-term question.
Okay. I don't know if Art is he on the line? Maybe he wants to answer that question.
So I'm going to allow 1 minute. Art, can Art be unmuted in order to ask that question? I'm going to reframe it, which just looks like, based on the patients that you see, particularly because you provide this, special service of bilingual medical care that's comprehensive for the community. Is there one particular health modality that you are seeing a particular need or increase that we should, as a community board, be aware of? So Art, I don't know if you have that information. Also, just to stay on time, we're happy to welcome you back for another discussion on that. If you
Sure. Hi, could you hear me?
Yes.
Hi, great. Hi, this is Art. I am the CEO of Borican Neighborhood Health Center. That's a great question, Eva. And it's a very general question, but I can tell you where we have distinct shortages are distinctly, especially in mental health and behavioral health services. I mean, there's just not enough providers for us to do all the behavioral health and all the mental health that we would like to have in a real comprehensive and complete manner. But of course, you know, everything is important. I mean, general medicine, pediatrics, dental services, it's all significant. But I think the biggest gap that we have, if we want to really pinpoint something, would be behavioral health in that category.
Good. Well, that dovetail with our district request. So thank you.
Thank you both. I'm going to move on. I see that Robin from our committee has her hand up, and then I will go to David Giordano, who was one of our former chairs of this committee. So Robin, the floor is yours.
Thank you. I was going to suggest geriatric mental health because the 2022 Councilmatic funding, there is special funding this coming year for that. So I think you do something that is really needed in an area that has no other support services as this. And since you do it, you should ask for it.
And since we'll be talking about the budget shortly, we're going to pause that to add it to the next portion of our agenda. I'm going to return to David Giordano. Sorry for the delay. David, the floor is yours.
David, go ahead and, okay, great.
Yeah, well, I can't see myself, so I don't know. I don't see any functions. Anyway, just in echoing, mental health is going to be a serious issue, and I would just extend that to even youth, as youth are returning to school. When we talk about behavioral health, the behavioral issues, kids are going to have a big adjustment going back to normal classroom and adjustments and those kind of manners. And, just being in different situation in COVID and how they've experienced maybe death and loss that we're not aware of at this time until they return to programs. And then also, we did, I believe 2 months ago, do a letter of support for the board for Boriken, and want to continue to echo that support and testimony as we go forward in our hearings with the Youth and Education Committee. So just.
Thank you so much, David, and for your service. We appreciate you. I am seeing that there's some questions in the chat. I'm going to ask Anne Marie and Art Perez to drop their information into the chat so that they can be in contact with that, and we are going to move forward on our agenda. I'm going to, are we allowed to just do a little shifting because I'm looking at the time and I want to make sure we get to the items that we need to vote on first. So Marlene, can I ask you to advance the agenda? And I want to thank all of our presenters, Padmore John, Lorraine Valentine, Anne-Marie Velasquez, and Art Perez for keeping us informed about how our community is providing services in and around COVID and health so that we can make sure we stay safe. So I'm going to ask Art Perez and Anne-Marie to please drop their contact information into the chat for any further questions. And we are going to go to an action item for this evening, which is a presentation by the Center for Comprehensive Health Practice. Just want to preface this by saying that CCHP came and presented to us a few months ago, and we were very much in support of their services. They are now going to have to shift their locations, and they are here asking for support, for a letter of support from CB11M so that they are allowed to stay within the community. Just a reminder from our previous conversations, which would be reflected in our minutes and our recordings that are available. This is a cornerstone organization that serves, that provides services to primarily East Harlem residents. And I want us to be mindful of that lens as we listen to their presentation and consider their requests. I'm going to turn the floor over to Michelle.
Thank you so much, Abnai. So I'm going to go ahead and share my screen. Just give me 1 second here. Okay, and let me just get to, hold on. Sorry, just trying to get to the side to be able to share everything. It's not letting me do that.
Someone's got a baby singing in the background.
Yeah, just see if I can do it this way. Hold on. Okay. Great. You can see my slide?
Yeah, I think there was also a video. I didn't know if if that.
Yeah, I'm going to show that in a second.
You'll run it? Okay, I just want to make
Yeah.
sure we need to run it. Mhm.
Yeah, okay, great. So good evening, everyone, and thank you for inviting CCHP back to present. I know, as Nye said, we were just here a couple months ago, but here we are again. So my name is Michelle Godot. I'm the Senior Director of Planning and External Affairs, and presenting with me is Dr. Marielle Fernandez, and she's our Chief Medical Officer and Pediatrician. She was here with me last time. So as Nye mentioned, we're here because CCHP is located inside of Metropolitan Hospital. We've been there for quite a number of years, renting 2 floors. And at the end of 2020, we had been informed that they're going to need their space back just to expand their own services, and asked that we move out sometime within the first half of 2021. And because, as I mentioned, we've been in East Harlem for so many years, our intention is to stay here in East Harlem, but we want to do that with the support of Community Board 11. So tonight, what we just want to do is, review some of our services. If there's anyone on this call who who doesn't know about us already, answer any questions that you might have about CCHP and our upcoming move. And then we're hoping to get this letter of support for CB11 that we can sign and sort of bring with us to our application. But before I move on to the next slide and sort of onto our presentation, you've heard from me already talk a couple of times, but I want to give some of our patients and our staff an opportunity to tell you a little bit about CCHP. So I'm just going to show a quick clip.
CCHP, I love this place. It's part of my family.
The Center for Comprehensive Health Practice is a home for life.
Well, it feels like home because I'm always here. It's more than just a health facility.
It's very important to feel like when you walk in that somebody cares.
You never see the staff in a bad mood.
People who work here, I think, are happy.
This is where I wanted to be because I know that I could help a lot of people here.
I like most of the doctors here.
Lift your hand and wiggle your fingers.
Our pediatricians are just amazing.
I want to be a pediatrician.
Ready? I adore Dr. Fernandez.
I love them all.
Everybody here has been instrumental in changing my life.
We treat them like family.
There's a sense of family here for everybody.
It feels like family. Coming to CCHP, I sort of came back home. I feel like this is the way I was trained to take care of patients.
I've been coming here for 30-something years. I hope they stay in the community, I guess forever, for as long as they can.
So CCHP, we've been in East Harlem for 60 years now, just over 60 years. And in fact, we're one of the oldest community health centers in East Harlem. And our ability to remain in the community for so long has resulted in generations of family coming to CCHP for care and providing what we call like our approach to family-focused care, where we treat the entire family. So I've been here at CCHP for 6 years now, and I often go out and do a lot of like outreach events. And I can't even really count the number of times when I've been stopped by like a complete stranger who will just tell me like, oh, I came to CCHP 20 years ago for treatment, or my mother used to see this doctor, or my child saw this pediatrician. And they're still feeling connected to CCHP even all these years later, to the point where they approach a total stranger just to like let me know that they know about CCHP and they're connected to us. So our name, Comprehensive Health Practice, is the heart of really what we do. Why should a patient have to go to different providers that might not be necessarily communicating with each other or kind of spread out throughout New York City when someone can get all of their care in one space and under one roof? So a lot of our services also came about when we just would identify barriers to care. And one of them was this our offer of free on-site childcare. So we noticed that a lot of our parents, caregivers, grandparents, they were having trouble maybe confiding in their physician or counselor because their children were present at the room, or they were often even just canceling their appointments and because they had no place to leave their kids. So what we decided to do was offer them free childcare and just remove that barrier. So now a parent can come in leave their child in a supervised playroom and talk to their physician or counselor in confidence. And this is like very much our approach to care, where we identify a barrier and rather, than just sort of ignoring it, we figure out a solution. And often it's whether it may be adding a new service at CCHP. We also offer all of our services that we provide are bilingual in English and Spanish. And because we've been here for so many years and we're really invested in East Harlem, half of our patients do live in East Harlem. And for those that don't, a lot of them used to live in East Harlem and choose to continue their care even after they've moved, whether maybe they've been in a shelter and temporary housing or just move around. I mean, I personally have moved around between neighborhoods and boroughs and continue to stay with my provider if I like them. So that tends to happen with some of our patients as well. Dr. Fernandez?
Okay, so I'll take a little bit to talk about the types of services that we provide. So in 2020, we were able to see 2,900 unique patients. 87% of those patients received primary care services, and primary care.
Dr. Fernandez, I'm so sorry to interrupt you, but there's a dark screen that keeps coming up over your presentation. Marlene, I don't know if you guys are seeing it or if it's just my computer.
Actually, I see it too, but I don't know why that.
I just wanted to make sure that people can still see the basics of,
Oh
the presentation.
no! Should I maybe take it out of full screen mode? Maybe that'll be better.
Maybe.
I see it as well, but let me see.
I feel like this one's a little better.
Yeah, I don't see it there. I don't see it there.
Okay, sorry about that.
There are questions already in the chat about the service, and I've asked the people to hold their questions until the end of your presentation. So I want to make sure that they can see this slide. I'm sorry for the interruption.
Okay. Michelle, if you need me to just assist you.
Is that better? I'm making it a little bigger like that.
Yeah, that works.
Okay.
Okay. 87% of patients receive primary care services. So we offer pediatrics, internal medicine, and family practice. 30% of our patients that were seen in 2020 receive integrated care or more than one service. So more than just primary care, they might get primary care and counseling services and things like that. 50% of outpatient counseling services are for significant others, meaning patients who have been impacted by another person's use. And only 1.6% of patients receive just medication-assisted treatment. Next slide. Okay, so this slide, we decided to show it in our presentation because I think it really gives you a good sense of our model of care. And it also shows you all the different types of services that a patient can access under one roof. So, we all know that you can't have good physical health without having good mental health, and vice versa. And I feel like as a provider, I can't address one and not the other because I can't just treat them individually. As this slide shows, they do overlap. I kind of wanted to take maybe just 2 minutes to describe for you a typical family that we'd see at the center in order to highlight all the services that this family would have access to if they were to get care at CCHP. So you have a mother of two that's diagnosed with diabetes at her annual physical. She tells her doctor that her partner lost his job to COVID, and as a result, he's abusing alcohol. He's drinking almost every night. She's overwhelmed with parenting stressors, and now with this new diagnosis. So immediately after her visit, we schedule her to meet with our nurses for health education and diabetes management. She enrolls in our parenting classes, and we offer her our on-site childcare services so that she can get the care that she needs. Her children are seen in pediatrics by me, and they receive an age-appropriate book at every well visit until the age of 5 through our Reach Out and Read program. She brings in her partner as a primary patient to enroll in our outpatient substance use counseling services, and she herself enrolls as a significant other. Again, seeking that extra support as someone who's been impacted by another person's use. And finally, she meets with her partner and a vocational counselor to help him get back to work. So that's just one of the many examples of the types of wraparound services that we can provide, and also the type of family-focused care that our community would get coming to CCHP.
Thank you. So I'm just going to finish up, but I just actually wanted to point out that our Significant Others program that Dr. Fernandez mentioned is actually available to anyone ages 5 and up. And that includes some of our psychiatry services, as well as I think his name was the CEO of Borican had mentioned that mental health services, especially for youth, is really important. And I think someone else mentioned that. And so we agree. And so we offer that counseling service to children. So we've talked about some of our work inside of CCHP, but we believe that to be a good partner would mean to take our services out into the community as well. So we started a couple of years ago these International Overdose Awareness Days. We partnered with Uptown Grand Central, with City Council Member Ayala's office. We had Gail Brewer's office there. And sort of these events are really to remember those who we've lost to opiate addiction. A couple of times we've actually invited Cado Paso to come and visit CCHP, and Dr. Fernandez and a team of physicians and counselors would be available on site to discuss these visits were discussing the importance of integrating mental health services with physical health for children and letting them know that we offer this service in English and Spanish. We also had hosted National Prescription Take Back Day with Manhattan President Gail Brewer, and also we had representatives from the Department of Health and Human Services visit. And we've done countless of events in East Harlem specifically, where we offer, free blood pressure screenings, overdose prevention trainings, and we've even gone to some of the local high schools to talk to the teenagers about sort of like some positive mental health practices that they can incorporate. So this is just a really quick overview. We want to thank you again for your time. We hope that this paints a picture as to our commitment to East Harlem so that we can get the support of CB11 to continue providing the same services here. I don't know if this, as I mentioned, we do want a letter of support because of our short time frame. We would like to get it as soon as possible, if that is something that the committee would consider. But in the meantime, myself and Dr. Fernandez would be happy to answer any questions that anybody might have at this time.
Great. Thank you so much to Michelle and to Dr. Fernandez. I'm going to recognize in the chat that there's also several board members here in support. I love to see that. And I just want to remind everyone that Noel Alicea from Metropolitan Hospital brought this to our attention back a couple of months ago, that they've had a longstanding relationship as a good partner with CCHP. However, they have now needs for this space, and as such, are requesting CCHP to find an alternate location within the community. With that being said, I'm going to open the floor to committee members for questions. I do want to remind everyone for the continued presentations that are going on. I've said this once, I'm saying it again, be mindful of the chat and please wait till the presentations are concluded before asking questions. We tend to find that your answers come during the presentation. So I just want to make sure that we're mindful as to how we use everyone's time. So I'm going to go ahead and open the floor to any questions, not comments, but questions from our committee members. Okay. And just to clarify, Michelle, for you, that was David Giordano, who is the former chair of this committee, who now chairs our Youth and Education Committee, who was talking about mental health services for youth as they transition through this COVID and with all the changes in schools and remote learning, and possibly experiencing loss of loved ones or community members. So I do want to recommend that you connect with him as a follow-up and perhaps work with him to highlight the services that you provide for our young people. So I'm going to go ahead and call on our amazing chair, Nilsa Orama, first. Nilsa, the floor is yours.
Hi, thank you so much. Now, I swear I don't pay her to say those things, but I thank her for saying them. I just have a quick question. Because of COVID, a lot of times some of our community doesn't feel comfortable applying like for Medicaid or services online because the digital divide. And I'm just wondering for patients who might want to be part of CCHP, do you have counselors that can assist potential patients who could get Medicaid, actually apply for Medicaid in a personal setting? Or is that something that you recommend that patients do on their own online or through HRA if they have appointments available?
I can answer that, Michelle, if you want. So actually we have, through our district partnership, we actually have a care manager working on site and also remotely, that she works with patients that have chronic medical conditions. And one of her things that she can assist them with is having them apply for Medicaid. She also helps with things such as accompanying them to their appointments, making home visits, and things like that. And on site, we have we have a lot of counseling staff who are more than happy to assist patients if they need to get their insurance, activated.
Thank you so much, Dr. Fernandez.
Thank you. I'm going to go ahead and check here. I see Eva had her hand up before the presentation even started. But I'm going to go ahead and call on you. Hopefully they answered it during, but if not, I will give you a quick moment to raise your question.
My question is, thank you for your presentation and again, your ability to provide comprehensive health care. My understanding is your center provides 10% of East Harlem's methadone dispensing capacity. And overall, East Harlem has 14% of New York City's methadone dispensing capacity. And in your presentation, you hardly mentioned your treatment for patients suffering from chemical abuse, or at least from drug addiction. So my question is, can you stay in East Harlem but cut some of your methadone dispensing capacity? Because after all, it is 10% of the East Harlem's capacity.
So I don't know what East Harlem's capacity is. I can tell you our number is about
a year.
Is how many?
About 5,000 people.
So our capacity is 444.
Right, which is 10% of that number.
Yeah, we normally don't even actually go to that high of a number. We, I think, are usually around 400. We can talk to, look about, I can't really make a commitment if we're gonna decrease our number of services. A lot of our patients come in for services just beyond methadone, as Dr. Fernandez showed. So if they are feeling comfortable coming in for their doctor's visits, why wouldn't we also provide them with the opportunity to get their methadone treatment with us, where the doctor that might be prescribing the methadone is also the doctor that does their primary and physical care and can sort of know if maybe something is going on with their physical health that might be interacting with their treatment protocol.
So
I think part of the reason
wait, Eva, wait. There was a question and there was a response, and now I'm going to weigh in. So hang on. We don't really do the back and forth. There's a question, there's a response, and then I get to comment. So I want to make sure that we are thinking of this framework based on the conversations we've had around what we want to see for the future regarding placement and sightings of our drug maintenance and rehab services. This is a 60-year partner that has been in good standing with our community within Metropolitan, that because of the use of services in Metropolitan is now seeking a letter of support to remain in the community providing services. This is also not a single drug treatment facility. This is a healthcare facility. And so people are coming to receive multiple services. So they may be getting, mental health services, pediatric services, other services. And so they are presenting, what they provide to treat the whole patient, of which methadone or drug treatment rehabilitation services may be one part. And drug is also a long part, right? We talked about alcohol addiction and others. So I want to make sure that as many people might have a certain lens through which they are seeing the issue of quote unquote oversaturation in the community, that we are not harming our long-standing solid community partners. This is a community partner that wouldn't be here today if not for this change with their current landlord. So I want to make sure that we are keeping this particular case in a certain framework for what this particular request is. And so I just wanted to make sure I state that. Eva, if she's answered your question right now, which is she doesn't know whether or not that's possible, the first and foremost issue is, can they stay in the community? Because if they're not in the community, what will happen and where will those residents that they serve from the community, of which more than 50% is East Harlem residents, what happens to those people? And so we want to make sure we are being mindful and supportive of a 60-year organization that's providing services to East Harlem, primarily East Harlem residents, which was a core component of what we discussed as part of our resolution, that we were going to support good standing cornerstone organizations that provided services to majority of East Harlem residents. So with that being said, and looking at the time, we still have to get to our budget, which is really an important part of our conversation. I am going to double check for hands raised from committee members and then attendees. I want to make sure that there are questions, and I want to make sure there's a question and an answer, and then we need to move forward. Michelle's information can be dropped in the chat for continued follow-up. So next I see Xavier and then Osendi. I just want to make sure I get the queue going. So Xavier, the floor is yours.
I will defer to Cindy. She had her hand up first, please.
Thank you. Osendi, the floor is yours.
Thank you so much. Thank you so much, CCHP, for all the services that you're providing the community. I truly hope that you are able to find a location within this community, as it would be detrimental to the growth and all the work that our committee members and service providers that have been doing for so long. My question was, who can we contact if we wanted to create some outreach support within New York City Housing Authority? A lot of our presidents have already shared their concerns of a lot of mental health services, and a lot of senior members who are having difficulties actually getting access to the services that you provide. Would you mind sharing the contact information so we can forward it to them?
Yeah, I just put my information in the chat, and it's also on the presentation that I had sent ahead of time. But feel free to reach out to me. I handle all of anything external relations, and I will direct them to the right person at CCHP immediately. So any issues at accessing our services can be directed right at me, and I'll forward it on to the program managers, and they'll take care of it.
Thank you so much, Michelle. I appreciate it.
Thank you, Osendi. I love hearing from our young members and how we can support our community. So let us know what we can do to support you in that effort. I'm going to return to our vice chair of our community board, Xavier Santiago.
Thank you, Nai. Real quick, thank you for presenting and the years of service. I'd like to and I appreciate that it was expressed that this wouldn't even be on our radar if it weren't for the relocation. And we appreciate all those people here who are both concerned and supportive as we try to navigate this very unique and singular world we're experiencing together. And it is very challenging as we try to find positive solutions that are human-centric. With that, I'd like to know two questions. Have you found potential locations? Where are they within our community district? You don't have to give an address, but just generally, so we know, because you're now at Metropolitan, which is in the southern part of our district, to find out where you would be headed. And then finally, as we are trying to work towards positive human-centric solutions in managing and mitigating our health challenges, in what ways we can continue to be better partners together, which I'm sure you'll be engaged, but if there are ways that we can sync up and work, so as beyond just issues with substance abuse, but like Osendi mentioned, like how do we link up our membership? How do we link up our constituency? These are all pathways that will help our overall health. So two questions: where are you looking? And how can we plug everyone in who's attending this meeting if they need resources, whether it's pediatrics onward? Yeah.
Great. So I will answer your first part. So we don't have a location yet. I wish we had one, because for us the clock is ticking. We have had some conversations with community members. And we have heard the concerns around 125th Street, and we know it's a congested area. So we are looking to avoid that that strip as much as possible. We have done, our realtor and ourselves have done like an extensive search of East Harlem and focusing in like the southern part. There is the issue of what space is available. A lot of the spaces that might be available might not actually fit all of the services that we provide. And then there is, of course, we are a small nonprofit. We're not a big hospital, so our resources are rather limited as well. So unfortunately, that's part of something that we consider also. So we have identified a couple of spaces that are one around 110th that we're looking at, but I don't want to speak too soon because I don't know. Number one, I don't want to jinx ourselves. And also, we're really, we don't know how everything will go yet. We are doing everything we can to avoid 125th, as I know that is the major concern. And in terms of how to, get the word out, that's actually something that we struggled with a lot within Metropolitan, only because we couldn't have signs up at the hospital. And often when I would go out to talk about CCHP, I would get somehow everyone would assume we were part of Metropolitan Hospital. So a lot of people who would come looking for CCHP would maybe just end up at Metropolitan. So I think that with our new location, this will actually be a really great opportunity for us. As I said, we are a small nonprofit, so our resources are limited, and most of our patients have heard about us through word of mouth. So I welcome opportunities to collaborate with folks that working in NYCHA, within youth organizations, whatever is out there. As nonprofit workers, we wear many hats, and that's one of the hats I wear. So again, you would reach out to me and I can, I would love to collaborate and come up with ways to really make sure that the community has access to our services.
Thank you so much. Was there anything else, Xavier, or?
No, thank you very much.
Sorry, it went in and out on my screen, so forgive me. I did see that there was a hand up from the public. Susan O'Hain. Oh, I'm so sorry, Susan. I don't want to mess up your last name. Susan O'Hainian. Can you please unmute and let me know how to pronounce your last name, please?
Hi, can you hear me?
Yes, we can.
Okay, I just wanted to say hello. I'm Susan O'Hannison. I'm the CEO of CCHP, and I really didn't mean to raise my hand, but I just want to, as long as I did by accident, I just want to say thank you for giving us this opportunity to present to the community board. And as Michelle has said, we would be happy to work with any of the community partners that we can and to do whatever services we can.
Thank you so much, Susan. Welcome. Thank you. Thank you to your board members and to your staff for presenting. I want to again remind everyone, CCHP did a much lengthier presentation, which is available through our office just a few months ago. So some of this is a reminder for those who might have been there, that they are an organization that's been here for 60 years in good standing, providing services. And just as a follow-up, I want to make sure that we are supportive of them. And I am going to say this, Michelle, we will support you wherever your journey takes you on the real estate route in CB11's parameters. Maybe we know someone in a district, to the south, to the north, but I just want to make sure that we are, there's not some superimposed organic limitation, right? We want to be in the CB11 family. And so if that means you're north, if you're south, if you're east, if you're west, as long as you're in our area, we'd like to support you in continuing to do the great work. So I don't see any other hand raised, so I'm going to go to Marlene and just double check. Marlene, do we put this for a vote for the support letter? Yes. I just want to make sure I'm following the right process. So
yes.
Mm-hmm. And do I need a first and a second motion to do the vote, or?
Yes.
Okay, great. So to the members of the Health and Human Services Committee, we've just heard this presentation. This is a timely manner. This is an unexpected challenge that one of our core service providers is presented with. We also know that given the pandemic, there may be an increased need for their services, and we want to make sure that because they serve such a high population of our residents, that they are able to do so, keeping in mind that they are a medical facility serving the whole person, of which Someone probably needs to mute their phone. I'm hearing some phone stuff. Someone needs to mute, of which, methadone and or drug rehabilitation maintenance services is a portion of their overall service. So I'd want to make sure we are mindful of that. So with that being said, I'm going to ask for a committee member to make a motion regarding their request for the letter of support to their application to OASIS to remain a provider in East Harlem. So I'm opening the floor for a motion.
Motion to support by Isaac.
Seconded.
Who was the second?
Sandy Garcia.
Great. So, Marlene, can you put it to a vote, please?
Sure, before I put it to a vote, Isaac, are you motioning to support the writing of the letter of support for CCHP? What is the clear motion, just before you guys go
Yes,
into that?
that's a great question. I think I'm supporting the motion to, it says the request for a letter of support supporting CCHP's application. So whatever it is, my motion is to support the letter that they need to remain a provider in Harlem.
Okay, Isaac, thank you.
Thank you.
And
sorry.
No, it's completely fine. I just wanted to be clear. And who seconded, Robin?
I believe, I didn't know if it was Robin or Cindy. I thought it was Cindy.
Oh, Cindy, okay. All right.
Thank you, Eva. Yes, it was Cindy. Appreciate it.
All right, thank you.
Great, so do we now call a roll for the vote?
Yes, I'm gonna call the roll.
Thank you, ma'am.
I just wanted to be clear about Isaac's motion.
Yeah.
Okay. All right, Rakeem Brooks.
Rakeem sent a note in the chat that he had a work emergency, so I'm not quite sure he's still with us.
Okay. I don't think so. He would have responded. He's pretty prompt with the responses. Eva Chan.
I support them to stay. I do hope to put some guardrails around methadone distribution and location.
Eva, this is a yes or a no vote. Are you voting to support their request for the board to write a letter in support of CCHP's application to OASIS to remain a provider in East Harlem? It's exactly what Isaac stated, and which is listed as item 5A.
Writing a letter. I don't know what is on the letter.
Right, so then the board will draft the letter and we will go from there. So right now, all they're asking is, they're requesting for us to provide a letter of support. There's a motion on the floor. It's a yes or a no vote. I just want to make sure we're on time because we still have to get to the budget. Marlene, was that recorded or do we need to have her restated?
It was a yes, because there was a bit of a back. Yes, Eva?
Yes.
Thank you so much.
Thanks, Marlene. Thanks, Eva.
Okay. Oh, Sandy, I know you made it, but I'll still call you. Sandy Garcia?
Yes.
Thank you.
Thank you.
Patricia Martin?
Yes.
Thank you. Jennifer Meyer?
Yes.
Thank you. Xavier Santiago?
Yes.
Thank you. Isaac Scott?
Yes.
Thank you. Robin Strachan?
Yes.
Thank you. And Nye Whitaker?
Emphatic yes. Can I do like the dance? Yes, sorry. No, I know it's 7:30, so emphatic yes. I have been here 46 years this week and I have known them to be a good partner. So I'm excited for them to stay with us.
Yeah,
So
the motion carries.
great. So thank you, everyone. I know that we are already at 7:27. I want to thank Michelle, Marielle, the board members, and also our committee for their great work. This motion has carried, and please let us know if Madam Chair is still on, what support you need from our community to move the letter forward to full board. I'm gonna then ask Marlene to advance. So I need to do some adjustments. And so is Marcy here with us? Marcy, we have another item we need to vote on and discuss, which is the budget. And it needs to make sure that we get this done before we get off this call today. So Marcy, I just want to ask, because there isn't a vote related to your presentation, if you would mind just holding temporarily so that we can review the budget items. We are on a deadline to get our comments back to City Hall, to the mayor's office, to our full board. I believe it's before the end of this week. Is Marcy here?
She may have stepped out, but I'm here representing her.
Fahim, would you mind if we just postpone and just do this in a little bit of a different order to take the next topic and then take you guys so that we can get to our vote? Thank you so much.
No problem.
Marlene, is that within parameters? Are we okay to adjust slightly?
Sure, I'll just move forward.
Thank you. Okay. So members of our committee, thank you first and foremost for your time. I want to acknowledge it's 7:29 and I know Robin sent an email about us making sure we got to the meat of our meeting and stay within our window. Our meetings have recently been a little bit longer, primarily because we do dedicate a large portion up front to talking about COVID and its impact on our communities. What the numbers are so that we stay present and can provide services and to be aware of how it's impacting our neighbors and our families. So thank you all for your patience. We're going to transition to the mayor's preliminary budget for fiscal year 2020. If you remember, a few months ago, we reviewed several items. Of which now the mayor, agencies and teams are presenting a preliminary budget and also have come back with responses to the requests that we previously made. So I'd like to ask Marlene if she could pull up what those items are so that we can review them and submit any comments, further requests, or items so that it can then be presented to full board and included in our preliminary budget. So just a quick refresher, there are several items. The ones that I think we should really focus on are that they're kind of in buckets. So there's several items marked number 3 in a level of priority, several items marked number 5 in a level of priority. There's one at a level 6 and a level 7. So I want to make sure, if you don't mind, I have here that there are a few, and we're going to go kind of line by line really quickly, because I also know people are on via phone possibly, to refresh people's memories. I hope that the committee member has read through this prior to the meeting so that they're not seeing it for the first time, and that we can move through this again with intention, but slightly expeditiously. So primarily what you want to focus on, and I just, Marlene, is there a way you could scroll to the right a little?
Sure.
Yeah. Primarily what we're focusing on is the agency response category and the agency category description. So it ranges from they agree with us and they're going to implement, which I have to be honest with you, if you scroll to that, there isn't that many, to the agency supports our requests, but there's no funding available. We do know because of COVID, there's been other allocations, but we also know that our community is often on the chopping block and we need to make sure we fight for every possible dollar to support our residents. To that they require additional information. And so I just want to make sure we quickly review these and provide any additional comments or requests so that this can be incorporated into our formal response. So I'm going to start with the first one, which was the request is under a category called other programs to address public health issues. The reason was an increased personnel was needed for needle pickup on 110th, 111th, 125th, and also at Clinton Houses, Marcus Garvey Park, and Ronald McNair Park. That went through the Department of Health and Mental Hygiene. The agency response was the agency will try to accommodate this issue within existing resources. It was ranked as a level 5, where the agency supports the request but does not have funding available to do so at this time. I want to open up the floor briefly to the committee members for any comment regarding that, with an eye around the fact that there are several programs in our community that are doing this work. We know that our own council member has gone through the community doing needle pickup. I know the Friends of Marcus Garvey Park have participated in. And so I just kind of want to open this up for brief comment from the committee members, you know, whether or not we're going to push further, make additional requests, and how we proceed with this. I see Xavier's hand is raised.
I think as a general comment, and I don't know if Marlene has it, and it's fine if she doesn't, but the register primed with the breakdown in community districts where they give comparison throughout all of our CDs. But we have had a decrease in general across the board, whereas in other areas we have definitely been upping. And I understand we're both in a massive fiscal contraction. However, during a pandemic, during a time when we are experiencing the worst parts of it, the kind of the abyss, we're being pulled out to the ocean. We're not actually, we should be funding more of these services, whether it's mental health, whether it's, you know, the hospital systems need to be funded. And I think, and especially in this community, which is a very vulnerable community, across multiple sectors. I think that would be one response, but that's more of a general comment. As we break down a lot of these requests, the needle pickup is more of a symptom we're trying to solve, but defunding the Department of Health and Mental Hygiene, that in general should not be happening at this point in time, not for our district. And I think that's across the board with each section.
Okay. So Xavier, your kind of comment or recommendation was we've seen a slight reduction, probably also because of the weather, and because of the fact that there's been a restoration of some of our sanitation and other issues, which, you know, during the original part of the pandemic or early part, we know we're lacking. So is there any additional commentary from the committee members by raise of hand to this item? I also want us to, as we go forward, you know, past this budget process, to be mindful of the fact that we may need to start, you know, having conversations and inviting other CBOs and even public-private partnerships into our meetings, time permitting, to talk about ways that we can be partnering around doing this work. Eva, your hand is raised.
Yeah, so my question is, since the existence of needles is not just a mental health issue, are there any other agency who might feel responsible to fund this? For example, OASIS, the Office of Addictions Support and Services.
I think that's a great question. What I would say from looking at all of the other answers that are here is it's still going to be a funding issue. I think as the parks are noted, McNair Park, Marcus Garvey Park, you know, there's probably opportunities there. But I would say that I would think almost any agency is going to have a similar response regarding funding. I'm going to yield to Xavier, who has. Xavier, did you hear me?
Real quick, and OASIS is a state agency, not a city agency, and there is some appropriation in how that kind of diverts, but in this particular budget, we're not going to see a direct correlation. But I think it is something we should take under for future conversation, how we can, and this is something that with Diana Ayala's working group, they are endeavoring upon, which is where are the gaps, where are we missing the pieces, whether it's with homeless services, NYPD, whether it's mental health, hospital systems, and then the state agencies' approach to things. So I think that's something we can take on. I don't know, but that's just explain that to everyone who's listening.
Yeah, thank you for that clarification. And I think also what I was alluding to was that the state budget will be coming up shortly in the April timeframe, and they will also similarly be saying, you know, referencing budget cuts as they consider requests. But I do agree with you, Xavier, that, you know, we should be working with, you know, our assembly member, our council member, and our senator to see, you know, how these funds could be allocated appropriately, whether it's from Parks and Recreation, whether it's from sanitation, whether it's from the city or state level. I also want to be mindful, that we are also allowed to make requests from our council members, for other funding, for special projects and initiatives. So, we might want to think about partnering with NIAM and other organizations here to be able to do that. Yes, Eva, I am aware that the Senate budget hearing for Oasis has already finished, but the larger budget for the actual state has not been completed yet. Are there any other hands raised regarding this first item? Are there any additional comments that we would like to have added to the record as a committee? Okay, I'm going to ask for the, Marlene, am I also supposed to open this up to attendees for comment?
If they have comments, sure, but sure, you can open it up to attendees if they have comments.
All right, so I just wanted to make sure I didn't see anyone's hands raised, so I wanted to move forward. So I just wanted to make sure I didn't miss anyone.
Someone's hand just went up, Sylvie.
Yeah, Sylvie Cohen. Sylvie, you have 1 minute.
Yes, I'm curious to know if no agency or funding is available for needle pickup. How do you expect the community to live with it?
So Sylvie, a couple of quick things. So one is some of that can be handled by sanitation. So needle pickups don't just sit there, depending on where they are. Some of it has also been handled by other groups that already are receiving grants funding working in our community. This was a request for additional services for specific areas, 110th, 111th, 125th, Marcus Garvey, Clinton, McNair. It wasn't for your general street that you're walking down by your building or block. This was for very specific targeted areas.
But we live by there too, because these are public spaces.
I understand, ma'am. I'm just making sure you understand what this request was. And what I'm saying is if the city doesn't have funding for it, we asked for it, the city is telling us they don't have funding for it. And would you like to host a needle pickup day?
We could, provided we know about it, that's something to consider, as well as in coordination with the services that provide other substance use, treatment.
Great. Awesome. So I will make sure that I follow up with you offline. If there are no other hands raised, I'd like to move to the next item. So the next item, I'm sorry. Okay. The next item was to create or promote programs to destigmatize mental health problems and encourage treatment. Our Community District 11 ranks first in the city for psychiatric hospitalizations. Funding from the new Thrive initiative should be targeted to improve programming in East Harlem. Support programs should be developed and better targeted to particular populations to encourage people to reach out and get help before needing hospitalization, so their mental health needs can be positively managed. Programs should annually assess and evaluate to provide assistance. And I can't see what the rest of it says, Marlene.
Okay, let me click in it.
Okay.
See if it makes a difference.
Targeted to improve programming in East Harlem. Programs should annually assess and evaluate to provide assistance with jobs, housing, education, medical issues, and other needs that this vulnerable population may have. Thank you. You can click out of that box. This was presented to the DOHMH from our Human Services Committee. The response from the agency is DOHMH funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent about available resources. It was ranked as number 5. The agency supports this request, but funding is not available at this time. Opening up to the committee first for comments by raise of hand. Pastor Isaac, were you planning to make a comment? I'm going to recognize you.
Yeah, sorry, I wanted to follow the rules. I apologize. I was wondering, just thinking about, sorry, I got my daughter. I'm just wondering, yeah, she's doing the most, I don't even know. I'm wondering, like, is there like I mean, there is a way. What about like really working with local grassroots organizers and organizations to do more like virtual events and programming and things that would go along the way, or go along the way of supporting, you know, the destigmatizing of mental health and encouraging people to get out? Like, is there other ways that we can just work with other people who do community activism and community advocacy to sort of put together initiatives or different projects that would, sort of fill these gaps in some ways? I don't know.
I agree. So yeah, I agree. I think this is all going to be about collaborations and partnerships, and we do have some great resources here in our district. I think we need more, but we just learned about this behavioral health services for young people while on this call, and that was just an amazing, new resource that we identified. And so I do think, so thank you, Pastor Scott, for that. We may need to take on as a committee, making a flyer that lists all of the mental health programs, or doing something in some way to better promote, as Osendi had just recommended, what's available here. Are there any other additional comments? And Xavier, I also just wanted to call on you. Should we be wording specific comments in any particular way if we do want to elevate an issue or throw it back at them?
So a couple of things. I mean, Budget Committee meets this Thursday. For those that are attending here, if from our committee and from the public, if you would like to attend, please sign up for this Thursday. We will submit our recommendations to the full board, which will vote next Tuesday. What we have been recommending, and we had our council member Kalos, who has a small section of our community district, is that calling out sections where, and what I've advised is a per capita, right? So we're looking at population density and then appropriation of funds based on everything that's going on within the community districts in comparison to the whole of Manhattan. And I think that, so if we have within CB10, 11, 12, and then one, I'm trying to remember the exact number, in the Bronx, that's just our sister community district in the South Bronx that has like Millbrook houses. We have like the lion's share of NYCHA. So, your comparative analysis is going to be different. So I think if in this review and during this discussion tonight, or if you notice something after the fact, please raise it to the Budget Committee that meets on Thursdays so they can elevate those recommendations. Also, we called in point, for example, and this has been a big talk of the town, has been the Department of Sanitation, where the Upper East Side and Community District 8 has almost double the budget of what we do, and we only had like a 23 or 30,000 something increase, which basically covers some overtime. But again, dealing with the reduction of services and where they have not lost those services, even though they have major corridors such as 86 and 96, which we share the northern part in 96. We still had questions on that, especially given the population densities. So those are different examples. In this case, we're dealing with the Department for the Aging and others, our health and hospitals. So any comments like that? I think one thing, thank you, Nye. I think we are still open for receiving a written testimony from the public hearing too, I think until tomorrow, so that it could be collated with. Then Carly is going to be helping us in the drafting portion. So if you just are bullet pointing stuff you notice, that helps us during the Thursday session. All right, I know that was a brain dump. Thank you.
I invited it. I always appreciate your insights and your wisdom. So I'm so happy you're on this committee with us. So thank you. I'm going to recognize Eva. Eva, did you have something for this item?
No, I think it's just my hand from the last question.
Okay, thank you so much. I appreciate it. All righty, anyone else from the committee? And I don't see any raised hands from the community. Okay, so I'm going to go forward to the next item. The next item is to enhance home care services. Funding is needed. I'm so sorry, hang on a second. Robin, did you want to comment on the previous one or the next one coming up?
Thank you. This one,
This one I'm about to read?
the DIFTA funded one. Yes, thank
Okay,
you.
give me 1 second, thanks. Funding is needed to expand services to our multicultural community of low income and below federal poverty level seniors. The agency is DIFTA. More information is needed from the community board before making a decision. The community board should contact the agency. The agency requires additional information. This is ranked as a number 7. Just to let you know, upon receiving this, I did ask Marlene if she could reach out to DIFTA, and we had not yet received a response. Again, I know that this is moving very quickly from when it was released by the mayor's office, to us in the time in which we need to review and respond. So we have not heard a response back from them, and we will continue to reach out to them because we thought it would be wise to ask them how we should reword it, what other option services they know are available, what funding opportunities are available. And so I do believe this requires a further comment. So I'm going to open this up to our members. First. Marlene, did you want to chime in? I'm sorry.
Oh, no, it's okay. Thank you, though.
Okay. I'm going to open it to our committee members first. I'm checking for a raised hand, and I believe Robin was the first one up.
Thank you. Yes, it should be more detailed, and the specific program is called ISEP. It's E-I, S as in Sam, E, P as in Peter. It stands for Expanded In-Home Services for the Elderly. And specifically under that umbrella, we need more hours for in-home services. That's what the request should really be.
Yeah.
There is always a wait list.
Yeah, Robin, can I ask you a favor? Could you type
Yes.
into the chat so that Marlene can just lift
For
it?
sure.
What
Done.
you said. And so I'm just recognizing for all the members of the committee that this item, which is kind of number 6 on our line on your screen, I know some people were making comments that they couldn't see the screen fully. It is number 311-202-111E, Enhanced Home Services, Enhanced Home Care Services. And Robin is going to supply the additional specifics so that we can go back to DIFTA to continue to explore this item. Any other comments from the committee by raise of hand for this item? We know that this was one we talked about a lot when we went through the budget tracker the first time. Okay, going to the general public. Okay, I'm gonna then move on. Thank you, Robin, for getting us the exact language. Going on to the next item, it's under the category of other animal and pest control requests. Provide funding for proactive measures to mitigate rodent populations in public housing, empty lots, construction areas, and train stations where rats establish colonies. We know that there's a lot of construction in our community. And as we dig up these places, which have been settled for a long time, it is now creating some issues across the community. It was given to DOHMH. Individual city agencies are responsible for addressing pest management on their properties. DOHMH's pest control program works closely with all city agencies to provide technical assistance in order to address these issues. Marlene, do you mind highlighting? Thank you. The rodent task force meets weekly to identify any hotspots and address them, with interagency coordination. If this was, you can click out of it. This is giving a priority of 6. The agency does not and cannot give priority to funding this request. One of our recommendations is that we should now reach out to this rodent task force and be able to have their information to share with the community so that we can elevate and make sure we are communicating the hotspots to them across East Harlem in a diligent and consistent basis until such funding can be allocated. I'm going to open it up to the committee for any comments on the rodent issue item. I'm going to open it up to the community by raise of hand. Okay. All right, we're going to move forward to the next one. The next one is increased management capacity, provide funding for more caseworkers. This is a DIFTA item. We have several DIFTA items. At this time, DIFTA has very limited or no funding for this purpose. Is their response. We will continue to advocate for federal and state funds to work with our city agencies. So this is an item which was given a level 3 priority. The agency agrees with the request, but funding cannot be determined at this time. This is one of those levels, one of those items, different from the one that was previously stated, where state funding could be incremental to support our city agencies. And we should explore this with our state representatives on the Assembly and the Senate, as well as our congressman, to make sure that from the federal side, he realizes this important need for additional funding for caseworkers for our community. I'm going to open it up to raise of hand for questions, comments from the committee first. And now the general public. Moving on to the next item. The next item is to allocate funds for outreach services to homebound older adults and for programs that, Marlene, do you mind going up a little bit? And for programs that allow the elderly to age in place, we should have said with grace and integrity. Or respectfully. So the next item says provide funding to ensure faster service for seniors transitioning from hospital/rehabilitation to home. It was under DFTA. At this time, DFTA has very limited resources or no funding for this purpose. We will continue to advocate for federal and state funds to work with other agencies toward this goal. When the funding is available, we are required to conduct an open competition. It was rated a level 5. The agency supports this request, but funding is not available at this time. Are there any comments from the committee by raise of hand first? From the general public? Okay, I'm going to move on to the next item. The next item reads, provide more HIV/AIDS information and services. East Harlem residents are more than 3 times as likely to die from HIV/AIDS as the average New York City resident. Sex education services should be provided, especially among vulnerable populations, and access to HIV prevention drugs should be easily and affordable to all. This was given to DOHMH. The response is preventing the spread of AIDS. Thank you. Preventing the spread of AIDS and other STDs is a top priority for DOHMH. Through a variety of condom distribution and community-based programs, we work to give communities the tools they need to stay safe. While additional services will be contingent upon available funds, please feel free to contact us to discuss available services in your community. That was given a level 5. The agency reports this request, but funding is not available at this time. Open this up to comments from our committee, and I see that Xavier's hand is raised.
I think this is one of the areas we typically respond back to when they say they don't have enough funding, because in previous years we've commented about how that it is still an issue that affects communities of color, which is what is the majority of our population here. Also, we've commented in the past and requests for funding services or programs that help those that are within the youth and the senior categories, and that is something we need to get in front of, because a lot due to PrEP. People think that they could pop a pill and be fine, and then on the other side of it, from the other bookend, is those that are in our senior population think, well, I should be safe. There's less likely for this to manifest. And having lost my uncle to AIDS, I can tell you right now, it's you have to be preventative, and I think this is one of the programs that we should also comment that, again, this is something that's still afflicting our community. That would be my one response, and especially because we are a community of color, we are in the lower socioeconomic brackets, and that we have to serve that community, make sure we're raising awareness and providing for those programs. That would.
Thank you, and I would agree. The majority of the items that are on here, I did have a long discussion with Marlene, and I had mentioned and gone back through several years of our previous budgets and tracking information. The majority of the items on here predate COVID, and so there are continued issues regarding allocation of resources to our already underserved community. And we need to be, but dogged about continuing to elevate all of these. So I thank you, Xavier, for that, because it continues to be a problem. I now see that Eva's hand is raised.
Yeah, so I can see that most of these funding requests has been rejected. Understandably, the budget is tight. Have we looked at other community boards to see if they are basically kind of subjected to the same issue? I mean, at least we should get similar funding, if not more, given how we're disproportionately impacted by COVID.
I'm in agreement, and I think that all of these might need the same similar comment that says this continues to be an issue for our community, and we request our fair share of funding to address this ongoing concern. Personally, I really think, but I will be attending the budget meeting this week. So thank you, Eva, for that. Any other, I don't see any other hands raised from the panelists, from the committee. Open it up to the community. Okay, don't see anything. Moving on to the next item. Thank you. Enhance home care services, provide funding to expand hours of home care provided to ensure fewer rehospitalizations. This was given to DFTA. At this time, DFTA has very limited or no funding for this purpose. We will continue to advocate for federal and state funds and to work with other city agencies toward this goal. When funding is available, we are required to conduct an open competition. That again was given a level 5. The agency reports this request, but funding is not available at this time. Opening it up to the committee. Opening it up to the community. I'm going to go on. Oh, Robin, please go for it.
It's a duplication, just worded differently of the previous request.
I agree.
Thank you.
I just think that we need to probably come up with one general comment that is going to go in all of these. That pretty much says, again, this request has been there and continues to be there, and we need to allocate our fair share.
Thank you, Chair.
No, thank you. Anyone else? I just want to make sure I'm not leaving anyone from the committee before we move forward. Okay. New item, if everyone remembers, we added this item in collaborations with our Parks, Recreations, Environment and Open Spaces Committee. It was other park maintenance and safety requests, explore alternative interventions for homeless and substance abuse in parks, including Marcus Garvey and Randall's Island, for example, contracting local CBOs, which is community-based organizations, to station a trained mental health worker in Marcus. And Marlene, I think I need you to click on that.
Okay.
In Marcus Garvey Park to provide assistance when necessary. Thank you. You can unclick. That was given to DOHMH. The agency recommends funding this expense budget request in FY 2022, but at this time, the availability of funds is uncertain. I feel like I'm playing a game of like Monopoly, which is sad. So we actually got something where they agree to give us the funds, but don't know what funds will be available. It is given a level priority 3. The agency agrees with this request, but funding cannot be determined at this time. There is a comment that Green Thumb has been carrying out its oversight role, but would benefit from additional resources, including staff, to expand its, Marlene, do you mind clicking? To expand its support of community gardens and help ensure the gardens remain thriving public spaces. That is a comment that came from our fellow committee. And we will also circle back with them regarding any other comments that they are adding in response to this. Opening it up to the committee by raise of hand for any comments on this item. Again, this is a collaborative item that we are duplicating and purposely including on our area because there's an overlap with a sister committee. Any panelists, or committee members by raise of hand for comment? Any attendees from the public or community? Sylvie, recognizing you.
I was curious if there are other departments of funding available besides DMH or MH.
Sylvie, I would like to invite you to attend our Parks and Recreation and Open Spaces meeting and or please email them. This item came from their request and they have asked us to duplicate it on our request. So I think the best source of additional information about this item should be led, or should I say responded to by them.
Okay.
Thank you so much. Appreciate it. I'm going to go on to the next item. So the next item is enhance home care services, provide more funding for expanded in-home services for elderlies and hours of home care. Again, this is a duplicate, but it's going to a different agency. This one's going to, at this time, DFTA has very limited or no funding for this purpose. We will continue to advocate for federal and state funds and to work with other city agencies towards the goal. When funding is available, we are required to conduct an open competition. It's a level 5. The agency supports this, but funding is not available. Again, there's some duplications, but they're going to different agencies. So we said the same thing in multiple ways, but to different agencies, hoping that one might have funding. Again, I think we're gonna have to come up with a general statement where anything is referenced for federal and state as to how we wanna go about that moving forward. I'm gonna open it up to the committee for comment on this particular item by raise of hand. I do see one panelist with the raised hand. Eva, please go ahead.
So I agree with you, Nye, that making a general statement is it's suitable. One idea about the general statement is I know in CB11 there is a lot of supporter who want to defund the police, and I think to the extent we do cut down the police force, I feel that we would need even more support for mental health, homelessness, and drug usage in the car and in the park and in the district. So, you know, to the extent we go ahead with that request, then I think we should just ensure that some of the funding is diverted to fund these initiatives that are not funded.
Thank you so much for that comment. I think that Marlene, is it Rocky? Who is our, excuse me, let me get my words together. Marlene, please remind me who our liaison to the budget committee is from this committee. Isn't it Mr. Brooks?
Yes, it's Rakeem Brooks and Jennifer Meyer, and I may be missing one more person, but I'm sure about Rakeem Brooks and Jennifer Meyer.
Thank you. Jennifer, I believe Rakeem had to leave for work. Can I please ask you to double check at the budget meeting? I will be there as well. You know, if they're going to be summarizing and having some sort of overall statement about how the budget cuts, you know, impact us that we could be using to replicate. I'm not sure. I tend to personally just not use the term defunded police. I tend to believe we need to reallocate or reinvest in our communities. But whereas the state and federal agencies, state and federal funding options may exist in a new administration and a new state session and budget, I think we should also be looking at those opportunities to advocate. Any other comments from committee members by raise of hand? Any comments from the community by raise of hand? Great. All right, ladies and gentlemen, I think this is the last, ladies, gentlemen, and all under individuals and community members and friends. I think we're at our last item. Enhance home care services, provide funding to hire more Spanish-speaking home care workers to serve the East Harlem community. This was given to DFTA. At this time, DFTA has very limited or no funding for this purpose. We will continue to advocate for federal and state funds and to work with other city agencies towards the goal. When funding is available, we are required to conduct an open competition. I think it might be interesting just separately to have a dialogue with Borican and other service providers. Also, we have, hospitals and other organizations here to see what we can do to
Maintenance safety.
Excuse me, Sylvie, can you put your phone
Oh,
on?
no, sorry, I don't know. Oh, sorry.
Thank you, ma'am. To make sure that we're aware of what services are available, particularly for bilingual home health care. I also know that there has been a recent interest in recruiting and training more home health care workers. And I know that our community board has been circulating a flyer where local organizations in East Harlem are recruiting and training home healthcare workers, particularly with language skills, and we need to do more to support that. So this is a level 5. The agency supports this request, but funding is not available at this time. I'm going to open the floor to comments from our committee first. By raise of hand, anyone? Okay, and then to our community and the general public. Okay, Now I get to call on you, Sylvie. Sylvie, please unmute.
So it was a mistake. Sorry about that.
No worries. Thank you for the clarification. So everyone, I know we had, two items that it seems like we're gonna double check on the wording and submit a revision on. And then overall, I think we're all in agreement that many of these items continue to be an issue. They predate COVID and now only are exacerbated by it. So I think we're gonna have to come up with just a general statement just for the record so that it is known that we believe we should be entitled to our fair share of services based on the population of our communities that are affected. Marlene and or Xavier, is there anything that I didn't cover related to this process that I need to cover and or address?
No, I think you covered everything. The final statement, just, to reiterate, will be has to be submitted to the Office of Management and Budget by February 15th.
Great. And I believe, Xavier, you said that public comment to the overall process is still being accepted. And then also, when is the budget meeting for this week for those that would like to attend, if we could remind them?
Thursday.
Awesome.
6:30.
Great. And you can check our website, cb11m.org, and check the calendar to get all the details and register for that session.
I believe Eva has her hand raised.
Thank you so much. Eva, please go ahead.
So given that there's little funding, what else can we do to proactively get more funding? Just by writing a statement, do you feel that it will be effective?
Well, I think we identified three things. The first is responding to this particular project by this deadline. The second was to make sure that we are also being proactive in contacting our federal representative, which is our congressman, and our state Senate and state assembly members about the fact that the city is declining to fund these requests. And so they need to be made aware for it in case that there are a way that they can allocate funds from the state level specifically for CB11 and its needs. And I think the third is, for us to continue to invite service providers that may offer provisions based on the areas that we know are continually on this list and continually go without funding in order to expand, including stuff like increasing availability and access of Spanish-speaking home care workers. Well, who are the home care training facilities in our neighborhood? Having them come and present, having them share their flyers, and making sure that we're promoting their recruitment and training and placement within this community. And that's just one example. I also think that, and Marlene and Xavier, please chime in. We are also, going to be having this discussion with our local our local city council members, to express, our concern about the fact that we come from a neighborhood which, has a high burden and is continually, on the chopping block for services and funding. Xavier, is there anything else you wanted to add to this, and or Marlene, since this is my first time going through this process as chair?
No, but if you go into the budget documents, and you will be able to see by department where they break it down, or by agency, excuse me, where they compare the community boards. If you find differences again in population and services, like again, as I recommended per capita, please note it and send it along to the budget committee. Because we're at our height, 50 members, so just dive right in. I look forward to seeing you all at budget.
And share it at budget. So Marlene, is this something that we need to vote on, or can we move forward to the final presentation?
No, you don't have to vote on this. You can move forward to the final presentation. I'll switch screens.
Thank you so much, everyone, for your patience. I want to just remind everyone, we have one more presentation for tonight about a service in our community that we want to make sure everyone knows about so that we can access and encourage others to access as well. So Marlene, can you remind me of the speakers? I know someone had stepped away and then was coming back. I believe it was Marcy was her name.
Yes, Marcy. I'm sorry. She's here. She's
Hi,
Marcy.
Marcy. My sister, thank you for your patience. I believe you had were allocated 10 minutes. What that usually means is about a 7 or 8 minute and then Q&A. But we do recognize that it is 8:12. So we are going to definitely allow you to do your presentation and to ask people to wait till the end of the presentation to ask your questions, but to be sure to be really quick with that raised hand so we can all get to our dinner and other activities tonight. So Marcy, thank you for reaching out to us. I know you've been on several other meetings with us and we're happy that you're here with us this evening to present.
Thank you so much for having me. I do appreciate all the presentations. I've learned a lot coming out and seeing what you all do, and I'm very impressed and hopeful. Can I share the screen?
Yes.
You can.
All right, here we go. I thought this was already. Hold on. Okay, I'm gonna have to go to another area. My apologies of all days. All right.
I'm gonna just take a quick moment. Marcy, we're gonna ask you to just go on mute for a moment. I'm gonna come right back to you.
Sure.
Marlene, is it okay if we ask if there are any announcements at this time? Excuse me, any, closing old business, new business, and then we can finish out with Marcy just to keep the schedule moving?
Sure, you can.
Great. So to the members of the committee, is there any?
Oh, she got it.
Oh, she's already, perfect, cool, okay. Wait, Marcy, it was just up and it looked great. What happened?
That's not it, however.
Okay. All right, no worries. So in regards to old business, I know that we started off this meeting with a conversation about a draft resolution that we are working from this committee. We will be putting that draft resolution back on the agenda for March to rework and revise. Right now, the feedback is it covers multiple areas, and we might need to break it up into multiple resolutions and or just hone in on one part in one area. That will be back on the agenda for the March meeting. In terms of, Xavier, please go for it.
No, just after I'll add on to that once you're done.
Yeah. So I just want to make sure there was a question about that in the chat and in the email. The resolution hasn't gone anywhere. We just were on a tight window to review the budget items and respond for this week. And so we are kicking it forward to March, and I will be working in partnership with Angel and Marlene, Xavier, Nilsa to revise it and represent it to the committee for the committee's discussion and input. And we will then be dedicating a portion of every month's meeting to having service providers that could be impacted by any potential resolutions come and present so that they can share in the discussion their recommendations, the services they provide, whom they serve in the community, and a bunch of other details so that we can have a robust discussion and make informed decisions on how to best support our community. And now I'm turning it over to Xavier.
Thank you so much, Nye. Really just to kind of add to that is that we're taking a very human-centric approach to this, and which is where we're all kind of aligned. And so if you know people, organizations we should be looping in out of the collective list so we can have a further discussion, I think it's really engaging a lot of the community, and we have a lot of the community at large who we need to engage. And I, for one, am willing to go out, as I have been doing, to make sure that they're at the table so we can have this full conversation, because a lot of people didn't even know this was on our radar. Members of various NYCHA buildings, whether they were separated like UPACA 6 or Johnson or Wagner, they're like, oh, you guys are discussing this. So I think it's just, we want to bring everyone together, and we've been doing such a good job with that. And I think and we want to do the right thing. And I think that's why we're going to take our time, and also to breaking it apart, because some of this is city, some of this is state, other this is coordinating with our partners in homeless services, and then breaking those pieces out so we know that we're coordinating all those factors, and not just not doing surgery with a hatchet kind of thing. So that was the overall consensus, and I'm looking forward to that work now that we have a plot line. So thank you.
Thank you. And so the original questions that we used to do the work and the original organizations that we spoke with will be re-elevated at the March meeting. All of that information will be made public and shared with the committee members and with the board, and then we will pick up from there to further expand that outreach and discussion. I also just want to, hang on one second. I just want to recognize Isabel is here from the Manhattan Borough President's Office. I see she's dropping a lot of items in the chat. Isabel, did you have anything that you wanted to share quickly? Okay. I don't hear her. Okay. So please check the chat for the information that Isabel is dropping from the Borough President's Office. And now I'm gonna turn.
Yeah.
Sorry. Hi, everybody. You have such a packed agenda. I don't want to take time. So I'm just dropping stuff on the chat from our newsletter. And I'm going to also share the link so that people can actually subscribe to our newsletters and get all these events. What I'm dropping is mainly relevant to East Harlem and somehow. So tomorrow, the NYCHA Town Hall, very important, because we do have in East Harlem some that are like directly impacted by this blueprint. So it's tomorrow at 5. Mainly that. Thank you.
Sure. Thank you, my sister. We're always happy to have you. And thank you for your work on behalf of our borough and our Manhattan Borough President. And I do want to recommend everyone that the Manhattan Borough President's newsletter is just so chock full of information, events, and resources. You should all be subscribing to it and sharing it with your neighbors and family members. So Marcy, it looks like you are back up and ready to go.
Yes, I am. I had to freestyle a little here. This is the website. I am going to read from the presentation that we have, which I'm not able to pull up right now. And Fahim had to go to another call.
At this time of the night, girl, we can all go to the website and check out some more information. So the one thing I will say after watching a couple of the other presentations today is you don't have to read everything word for word. I would like you to, give us the top line, let us know who you serve, why you serve it, how we can get in touch with you, and if there's anything specifically coming up that people can participate in, and the rest you can drop your link, contact information, and website into the chat. And then you're welcome to always email us flyers and information, which we can include and share out to the community. So the floor is yours.
Excellent. Thank you. So my name is Marcy Keenan, and I'm from Preventive Lifestyle Assistance Network here in Harlem. I was born in Harlem Hospital, raised in Schaumburg. A lady from earlier, Mrs. Vasquez, apparently works with us here. Our mission is to eliminate type 2 diabetes in marginalized communities where members are often unaware that this condition is preventable and reversible with positive lifestyle changes. That's a very important part of what we are doing and what we're going to be expanding on, because the messaging that goes to people in our community is generally hopeless, and it does not encourage people to do self-care. And we're going to be working on that as well. We do the diabetes prevention program. It's a CDC program. It's evidence-based. A lot of different hospitals present this particular program. It's a year-long program. I just was doing a makeup class. I had to go do a makeup class and come back. We have a class, our first Spanish language class coming up. Right now, we're doing everything online. We started out at Ephesus SDA Church in person before COVID-19 hit. Some of the challenges, just so you can get an idea, according to the American Diabetes Association, in New York, an estimated 2 million or 12.5% of the population now have diabetes. Of these, 517,000 have diabetes and simply don't know it, which is another problem. In addition, 5,412,000 people in New York, or a staggering 36.2% of the population have prediabetes. And every year, an estimated 66,000 people in New York are diagnosed with diabetes. You see, November, National Diabetes Month, our goal became to get 1 million people to check their risk. It's a very simple test created by the American Diabetes Association. We kind of co-opted and put it on our own platform so we could track it. And basically, for 1 minute, you're answering 8 questions that will give you a great idea as to whether you're at risk of developing type 2 diabetes. It's important because so many people walking around pre-diabetic and with diabetes, and they don't know it. And so in addition to our being a provider of the CDC's diabetes prevention program, we are also aiming to make sure awareness is increased among the population. And we're also going to be working with another organization called the Institute of Wellness Education with Dr. Deb Teplow, who has specialized in helping health workers be more effective in the way they interview and kind of recommend self-care to people. If I have family members who have had amputation, they've gone blind and they've died of heart attacks due to type 2 diabetes, and you present it to me as, well, I'm going to put you on metformin right now, and eventually you're going to end up on insulin, and that's my hope, I have no reason to make any lifestyle changes. And in fact, diabetes type 2 is preventable and it is reversible, and not a lot of people know this, and not a lot of health professionals really push that fact. We have our first Spanish language class coming up online. It is February 23rd. It's on a Tuesday from 7 to 8 p.m. We have what's called an orientation a week prior to that, which is going to be on the 16th from 7 to 8 p.m. We're very excited about the fact that we are taking care of all the community in terms of languaging. I'll end by saying we want more partners. Currently, we're blessed to have the Institute for Family Health as a partner. We are the provider of the diabetes prevention program for them. They have 30 plus locations, one of which is on 118th and Madison Avenue. And we're looking for more of those relationships. We are New York State Medicaid certified, and we're CDC certified as well. It's an important program. A couple of people who are on tonight, we could easily partner with them to present this important preventive service to the public. That's it.
Awesome. Thank you, Marcy.
Yeah.
Marcy, I just want to ask, if you haven't already, you're welcome to resend to Marlene the PowerPoint presentation so that we have it on file and available to our board and to the community. Again, I know you've sent stuff in the past, but continue to send your flyers over. I'm going to open it up to see if there are any questions from our committee. Any committee members by raise of hand? Okay. Anyone in the public by raise of hand? Miss Sylvie, I see you had a question. It said question related to the service provider presentations, but I wasn't quite sure what you meant by that. And I know your hand was up before and then went down. So I'm gonna just give you a quick 1 minute opportunity if there was something you were trying to say that didn't get elevated.
Thank you so much, Chair, for giving me that opportunity. Yeah, I think this is a great initiative for CB11 to invite service providers and for them to present their profile, to get a chance to say what they're doing. And you mentioned that you are looking at them choosing them according to them being impacted by the moratorium. I would like to suggest that we
Sylvie, let me clarify. I don't mean to interrupt. Let me clarify. Every month, CB11 invites service providers across the community to present, not just related to the moratorium.
Okay.
So as you saw at the beginning, we had a COVID presentation. So every month, and how Miss Marcy is presenting right now. So every month, we provide. They have 3 options. Sometimes they're coming in the announcements just to say that an event is coming up or they're opening an office, etc. That's announcements. Or they might have an informational update. For example, we are going to be giving out free PPE, and this is how you have to qualify for it. You have to make X amount of money, blah, 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 Or they might have an actual presentation and discussion because they're changing a service, need us to write a letter of support, want to do a survey, or there's an action around it. So there's 3 different ways. We moved this particular presentation around because of the timing and the other work that we had to do. This would have been a much earlier presentation right around the time of board weekend. So I thank Ms. Marcy for staying to the
Thank
end.
you. My question was in relation to that, whether or not they're related to the moratorium. If the community board or the community members could ask them to also, we could use an accountability framework, and also to say which population they serve, and the funding sources, to have also our say on their presentation, opportunity to request, a little more information about what we want to know about,
So as it relates to someone that is presenting in the area of a homeless shelter or single adult residency or drug maintenance and rehab, that is a question that we ask. For many of the others, on their websites or their annual reports and other information about who they serve, and we do normally have a component of their presentation that discusses what services they provide, what portion of our community they serve, and what their treatment modalities are, and kind of what their incomes are they a state agency, are they a city agency? So that is something that normally is presented. Again, depending on the type of presentation they're giving. Marcy is just here to let us know this exists. So if there's additional information that you would like to learn about her, she's dropped her information in the chat, you can ask it. At other points, when there's discussion and presentations, that's when you will see some of that more detailed. So it depends on what type of presentation and the topic that organization is presenting on. You will see different types. As you saw, some people were 5-minute presentations, some people had 15 minutes, some people had 10 minutes. So it depends on what category they fall in. And I continue to invite you to come to our future meetings so that you'll be familiar with what those systems and kind of categories and target areas are. I see Xavier has his hand raised.
Real quick, thank you, Marcy, for presenting. Youth, do you educate youth on diabetes and diabetes planning as well? For example, working with those that say they have a parent who's suffering from diabetes and you're trying to get them back on track, or they're on that pre-diabetes, and is there any kind of intervention? Because oftentimes studies have shown that there's often a familial connection. Like my grandfather had diabetes, and we have learned, because I'm hypoglycemic, like how to adjust that. But we learned through his experience and then how to modify my diet in a way. So, because I can just eat regularly and otherwise I turn into an ogre. But do you have part of that as your program?
So the program that we do it's laid out. It really is kind of cut out by the CDC. There's a certain amount of modules. Now, because I personally am pre-diabetic, I was diagnosed in 2012, and I'm also a trainer. I have some additional information that I can give people on top of that. In a class I have right now, I have 2 sets of mother and son, and a daughter and her mother. So there is some interaction between people, and people taking information to their spouses. And in fact, spouses are invited into the program. They can actually come in and hang out. So, but this is really for people who make a decision to, take care of their pre-diabetes. And we actually are allowing people who are type 2 diabetic to come into the program, though it is a program that is geared towards pre-diabetes. And when everyone's talking about funding here, New York State, as of February of last year, pays for this program, but they won't pay for someone who's already type 2 diabetic. We invite people in. There's a self-pay option, and to be quite honest, we're letting people come in at no cost to the community because it's an important service.
Thank you. Thank you.
You're very welcome.
Any other questions from the committee? And then by raise of hand?
Eva has her hand up now. I'm not sure if it was previously or for this specific presenter.
Eva, did you have your hand up for this particular presentation?
Yeah, for this presentation.
For Marcy, please go ahead.
So thank you so much for your presentation. Our diabetic rate in East Harlem is quite a bit higher than Western Manhattan. So thank you very much for coming here. I'd just like to point out on the CB11 website, there are a fairly comprehensive list of all the healthcare providers, and I really hope you can successfully partner with them. So if you just go to the resources page, you can find all of them. So if you need help, hopefully we can help you connect with them as well. So my question was actually directed to an earlier point, Sylvie's point about asking for data. And now I thought that's a good idea because in the resolution, one thing that we ask is, improve transparency of sources of funding from different providers. Or type of patients they serve, demographics and whatnot. So if we come up with a few kind of data points and have these providers provided to us, does it sound like a good idea?
I think it depends on the type of presentation they're making and the category they're in. So if someone's just coming for an informational update, which is 5 minutes, they may not be able to do that, right? So that's why I was just stressing that it depends on what it is. And yes, as the chair, Nilsa Arama stated and Xavier restated, we are going to come up with a specific set of questions that each service provider will be repetitively asked to present on, so that we are going to compare apples to apples instead of apples to oranges. So that is already in the works. And yes, I will be working in the committee to make sure we have that, but that will only be in that category of presentations and discussions. So if X, organization comes just to let us know they exist, and it's a 5-minute presentation, most people have that information on their website, or you can email them for the additional. For the categories, that we think are going to be affected by the moratorium and or service providers in that category that present, then yes, I think, as we have already asked with CCHP, asked with Salvation Army, asked with Metropolitan, asked with Borinquen, we've asked a certain set of questions, which will now be made public and expanded upon and will be consistent across. But I also want to encourage everyone, technically this meeting is supposed to be a 1-hour meeting from 6 to 7 p.m. So as much as possible, I want to invite and encourage all of you. I've been here, as I said, 46 years, to get to know these organizations outside of this monthly meeting. So Borinquen Center, if you have a question about them, they're right down the block, right? You can take a walk over, grab your cup of coffee, go see them and say hello, email them. All of these service providers are here because they are passionate about delivering service and about the health and wellness of our communities. And so I encourage you to continue to attend ours as a check-in, but I also want to make sure that you are very familiar as a resident of this community of all the services. And as Eva mentioned, there's a wonderful listing of all the service providers on our website. Please don't overwhelm them with 1,000 questions in the middle of COVID, but I'm just saying I want to encourage you all to be familiar with them so that when they're coming to present at the community board, it's a refresher, it's an update, it's a how are you doing, learning that there's a potential cut to a program, how can we help you? Oh, you want to get the word out about how can we help you? Don't let this be the only time you're paying attention to organizations that have been in our community for many, many years, doing good work, providing good services. Let this be the refresher, and let this be an opportunity to learn about new ones that you can then support, use for your own resources, share with your neighbors and your family members. I'm going to call on David Giordano, and I believe that is the last item for tonight. Mr. Giordano, the floor is yours.
All right, so I just want to add really more reference to Xavier about youth and diabetes. So about 10 years ago, Mount Sinai did a study and did education around diabetes, and it started with HEED. Then about 6 years ago, they started the Team HEED, in which they do educational programs and testing around diabetes for youth and predict pre-diabetes and try to get kids to, change habits and stuff. So there is a program. I can put us in contact. I used to be a board member on the board for the Teen Heat program. And it's really been wonderful at coming out and working with our CBOs and, giving educational workshops to kids and also doing testing. And then providing them options for treatment.
Thank you so much. And as was stated earlier, we know that diabetes is a huge health issue in this community because of lack of access to food and education, pre-existing conditions, et cetera. And so whatever we
Can I
can do.
just say one thing?
Hang on one second, Marcy. Let me just finish my
Sure.
sentence. So whatever we can do to educate everyone and help to address it and alleviate it is important. Marcy, I'll give you one more minute and then we're going to wrap up.
Yeah, just so you'll know too, I just had Montefiore Hospital reach out. Their diabetes people reach out. They do a wonderful job over there with this particular program. And one of my lifestyle coaches, Fahim, who was just on, in fact, is going to be participating in a trial, a pilot with them on an all-male diabetes prevention program, right? Because there's some issues that come up for them that they probably don't want to discuss in front of everybody. So youth and men, those target markets, we haven't gotten around to that yet other than participating in this pilot. There needs to be more done. I have a 16-year-old, the parent type 2 already. And so we will allow people into the class, even though it has a limit of 18 as it goes to the CDC, but as an entity, we can invite that. Again, we eat the cost of it,
Awesome.
right?
Thank
But
you.
yeah, it's an important area, and more young people are coming up pre-diabetic and type 2 diabetic, and it's an epidemic, really.
Thank you so much. Thank you, Marcy.
Yes.
Thank you, Xavier. Thank you, David, for pointing out the importance of making sure we educate our young people about this. And so I believe we have covered everything on the agenda. I just posted a note thanking everyone for their time, their patience, their diligent discussions, their questions, and your continued attendance and support of the Health and Human Services Committee and the work of CB11. We care deeply about our neighbors and our community, and we look forward to continuing to work with Marcy, I'm just going to ask you to put yourself on mute. And if there are no other questions or announcements from the committee members, I am going to ask for a motion to adjourn.
Xavier, move to adjourn.
Thank you, Xavier, for the motion. Can I have a second?
I second, Robin.
Thank you, Robin, for hanging in here with us tonight. So I'm going to turn it over to Marlene to close us out.
Or I could do a roll call vote, or you could do this one by acclamation and stick to
I think we should do this by acclamation. I want to thank our amazing chair, Nilsa Arama, for being here with us this evening and for her continued support and leadership. Thank you also to Xavier and Marlene for walking me through this first process. Marlene, was that you about to speak?
No, that was Robin. She had something to say.
Oh, Robin, please go ahead. She might have just said good night. Okay. All right. So if there's nothing else, I want to thank everyone, and I think we're going to do a vote by acclamation. All in favor of adjourning, please say aye.
Aye. Aye, 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 aye.
Any abstentions?
No.
Any nays? Anybody who wants to stay and hang out some more for a little bit longer?
Good
Love
night.
you, but not that much.
We love you. Good night, everyone. I appreciate you all.
Good night.
Good
Well done,
Thank
Nai.
you.
Well done. Well done. Thank you, Marcy. Good night.
Yes.
Good night.
Everyone.
Thank you all. Appreciate
Please
you.
tell your counterpart I said hello, my brother from Schaumburg, who I've worked with for many years. I know